What is an obstetric nurse? So an OB nurse is a registered nurse who helps female patients during pregnancy, labor, and childbirth. The role they play in the medical field is a huge role in which to care for newborn babies and care for the woman while she's in delivery. Obstetric comes from the Latin word obstetric, which means midwife. Midwifery dates back to the Old Testament in Egypt, where midwives delivered babies and educated other females about having children. Around 500 AD to 1600 AD, midwives were seen as incompetent and midwifery was outlawed. Male surgeons began to push for obstetrical care. Midwifery was deemed competent around 1600 AD and continued to do home deliveries by the 19th century. 1890 to 1921, due to overcrowding and industrialization, it led to an increase of hospitals. Infection was the most common cause of death of mothers, accounting for 40% to 55% of maternal mortality in the late 1930s. Toxema caused approximately 20% of deaths, and hemorrhage another 20%. Birthing at home became too dangerous, and it was preferred to do it in a hospital. In 1921, the Shepherd-Towner-Infantile Protection Act was a federal law that encouraged states to improve maternal and child health in hospitals. 1930 to 1980, the American Board of Obstetricians and Gynecology was established. Obstetricians tried to assert dominance over the midwives and tried to experiment to find easier ways at birth. By the 1980s, hospitals introduced labor and delivery rooms. And this brings us to present day.
Who do they help/care for? Obstetric nurses care for pregnant women and their babies during and after pregnancy delivery. What are the responsibilities/duties of an obstetric nurse? OB nurses have a number of different responsibilities on a day-to-day basis. During the labor and delivery process, OB nurses are responsible for utilizing equipment to monitor fetal heart rate and contractions with frequent updates to the medical director, prepping the mom for delivery, gathering sterile supplies for delivery needed, noting signs of potential complications and reporting them to the doctor, starting an IV, drawing blood, administering pain medication, labor coaching, going into the operating room with women who are going to have a C-section. Next is post-delivery responsibilities. OB nurses assist mothers with breastfeeding or formula to ensure adequate nutritional needs. Monitor and manage vital signs for mom and baby. Monitor and manage complications due to pregnancy and delivery. Lastly, postpartum care responsibilities. OB nurses help in assessing C-section incision site, administering pain medication, teaching about newborn care, applying ice packs, monitoring swelling and bleeding, helping mom to move and start recovering, helping with bonding between parents and their babies, drawing blood for tests, administering any necessary shots are the many responsibilities, and OB is responsible on a day-to-day basis for their job.
An obstetrics nurse or an OB nurse needs to have achieved a high school diploma and an RN license from an accredited associate's degree in nursing or a BSN program. During schooling, the nurse needs to pass their NCLEX exam from their university. After graduating, a nurse needs to have 2 years and 2,000 hours of experience working in the obstetrics department. Then the nurse can achieve an OB nurse specialty certification, which allows them to be an OB nurse. An OB nurse would typically be working in the labor and delivery departments of hospitals, private doctors' offices, and some nurses work in birthing centers and health clinics, where some mothers choose to have this experience in delivering their babies. An OB nurse needs to have slightly adapted nursing qualities to work in the obstetrics field. An OB nurse needs to have compassion for their patients, as they are going through a very sensitive, emotional, and possibly difficult time in their lives. The nurse needs to have advanced critical thinking skills working with labor and delivery due to the time sensitiveness of the situation, which is why it is so important to have experience working with mothers before becoming an OB nurse.
Obstetric nurse or an OB nurse has one of the most rewarding and unique jobs in the healthcare system. They care for women in the most important journey of their lives. This means that you provide care from preconception and post-delivery. You help doctors do prenatal screening, mammographs, and even be present during labor, which eventually plays a huge role in the woman's pregnancy. This is important to create a relationship with an expecting mother in the family because as an OB nurse, you can make a childbirth experience the best and one where a mother will always remember. They not only care for expecting mothers, but they care for the family and when the baby is born, which is a pretty big role. You want mothers to feel comfortable and for trust to be present amongst everyone in the room. If you want to build more of a caring relationship towards your patients, teach or coach women during labor, assist them with all their needs during their journey, then OB nurse may be the right career choice for you.